So good afternoon, everyone. So my name is Gurleen, and I'm going to take a lecture on infection and infection control. So first of all, if we talk about infection, so infection is in which a microorganism enters the body of a healthy individual and it can cause disease. So this is known as infection. Okay. So if we classify broadly, there are two types of diseases. One is communicable, one is non-communicable disease. So communicable diseases are those in which there is a spread of infection from one individual to another individual, say from A to B and then to C. So that is known as communicable disease. Non-communicable disease are those diseases in which there is no spread of infection from A to B, like in cancer, hypertension. They cannot spread from one person to another. So they are known as non-communicable diseases. Okay, so I'll be sharing now a slide with you. So I hope you can that is visible to you. Okay, so first we will talk about chain of infection. So chain of infection basically depicts the cycle, how the infection is transmitted from one person to another. Okay, so firstly we have infectious agent or pathogen. So infectious agent or pathogen, it is the agent that causes or the microorganism which causes the disease. So it can be either bacteria, it can be either virus, or it can be fungi. Okay, so that is known as your infectious agent, or we can say more specifically pathogen. Then you have reservoir. So the home of the infectious agent, that is the where the infectious agent grows, stays, multiplies, that is known as the reservoir. Portal of exit is the gate through which the infectious agent leaves the reservoir. That is known as what? Portal of exit. Okay. Mode of transmission, then from one individual to another individual, like from reservoir to the susceptible host, how it will transmit. So that is known as mode of transmission by air, droplet, contact, how it will go from the reservoir to the healthy individual. That is known as what? Mode of transmission. Okay. Then you have portal of entry. Then when it reaches the gate of the host, how it will enter. Okay, so that is known as portal of entry, from which route it will enter. We can say that more specifically. Then you have susceptible hosts. So susceptible hosts are those which meets the criteria of a susceptible individual. That means the person who has at risk of getting infection, like high risk groups, that is infants, newborns, preterms. Then you have with immunocompromised system. Then you can say old age people, patient on immunosuppressive drugs, then autoimmune diseases. All these people are what? Susceptible hosts who can get infection very easily because the infection fighting barriers are they are not working right now. So because of that. Okay, so chain of infection, first thing is infectious agent, then you have the home of the infectious agent, that is reservoir. Then from the gate from which the organism exits from the home, that is known as portal of exit, how it will go from one healthy or from the reservoir to the susceptible host. So it is known as mode of transmission, and from which route it will enter, that is known as portal of entry, and in whom it will occur, that is known as susceptible host. Okay, so then we have two things: one is incidence, one is prevalence. Incidence is new cases which occur in a community, that is known as incidence, and new plus old cases of the same disease is known as prevalence at a given time. Okay, so that is prevalence. Then we have three types of precaution. First is standard precaution, which are applicable to all the patients. Then you have airborne precautions, then you have contact precaution, then you have droplet precaution. So first we will see about standard precautions. So this is for all the patients that is applicable. So all body fluid are infectious, all blood-borne diseases, you will take standard precaution. Then all the people whose mucosa and broken skin, for them you will take standard precaution. Hand hygiene is very important step if you want to prevent cross infection from one person to another person. Okay, so next is gloves. You can add if you can see the secretions are visible, or mucosa is open, or skin is open. So in those people you can add gloves also. Then eyes, nose, mouth, if these are the portal of entry, then you can add face shield, mask, goggles if you can see splashes, secretions coming out like during coughing or during suctioning. So in these things you can add these precautions also. Gown can also be used if splashes are expected. Then needle should never be recap. You have a sharp container, so in that you will put the needles, burn needle, and then you'll put in that. Then solution of bleach for spills you have to keep. then if you see that two patients of a same disease or for different diseases, and you are taking same kind of precautions for them, then you can keep them together. Okay, so that is known as cohort. When in case of emergency you need the more space, then you can keep two individuals with same type of precautions together. Like the ones with air precautions, you can keep them together. The ones with contact can be kept together, but you cannot mix airborne with contact or with droplet. You have to keep these separate. But for airborne, all those with airborne precaution, you can keep them in a single room. Okay. Next, you have first is contact precautions. So in this, you have to always wear gown and gloves, dedicated equipment like stethoscope, BP apparatus. So it means that what do you need? Dedicated equipment, which means one equipment for one person. You cannot use the same thing for all the patients because it is contact precaution, touch. Okay. Then double bagging system should be there. Private room can be there. Open door should be there. Okay. So because the infection is not in the air, so you don't need to keep the door closed. So you can keep the room open. Then whenever the patient is transported, so for transportation, you have to keep two things in mind. Firstly, you have to always see the area or transport to the area from where the people or the individuals are less. Okay, there is less in that. You can say people are less over there, visitors are less, or the patients are less over there. Those hallways you should always select. Okay. So then, in which cases do we use contact precautions? Firstly, skin, that is multi-drug resistance organism like MRSA, VRSA, CRE, VRE, then impetigo, abscess, cutaneous diphtheria, scabies, pediculosis for first 24 hours. Then diarrhea, if it is C. difficile, rotavirus or norovirus is the cause. Then any other infectious diarrhea is only standard precautions. But if the patient is incontinent, then you have to take contact precaution if the diarrhea is for any other cause, except for C. difficile, rotavirus, norovirus, you have to take contact precautions. But if the diarrhea is caused by any other infectious source, then you have to use what? Standard precaution, contact precautions. Okay. Then next you have RSV, that is bronchiolitis, and parainfluenza. For these, you have to use again contact precautions. Then we have droplet precautions. So for droplet, if the droplet will come out, then only if the other person will inhale the droplet, then the infection will spread. Okay, so in this you can use regular surgical mask, and you have to keep the distance between the staff and the patient of 6 feet, or the visitors also. Then client should wear surgical mask if the patient moves out of the room. Then private room can be there and with open door. Okay, because the air is not infected, so you can keep the door open in this. So the mnemonic for this is Spider-Man. So S for is for streptococcus throat. For 24 hours, you will take precaution in case of scarlet fever for first 24 hours. Then P is for pneumonia if the cause is streptococcus, mycoplasma, plague, Hib, and in case of pertussis. First is pneumonia, second P is pertussis. Okay. I is for influenza. Then for influenza, you will take droplet precautions. For parainfluenza, you will take contact precautions. Okay. Then you have pharyngeal diphtheria. For cutaneous diphtheria, you will take contact precautions. And for the other diphtheria, that is pharyngeal diphtheria, you will take droplet precautions. Okay. Then you have E for epiglottitis. Then you have R is for rubella, rhinovirus. And in case of rhinovirus, you can add contact precautions also. See, we've seen there. Okay. Then next you have mumps and meningitis. For first 24 hours, you can take droplet precautions. Then for adenovirus, you have to add contact precautions. Then you have airborne precaution. Now see, the air is infected, so we have to keep the patient in a single room with negative pressure, because negative pressure helps to keep the air trapped in that particular area. So this is one thing. So you have to use a room with a negative pressure. Okay. Then you have closed door. Why? Because the air is infected. So if you will keep the door open, the air can go out. So you have to keep the door closed. And you have to keep this in mind. If the patient is on airborne precaution and you are keeping the door closed, then the patient is at risk of social isolation, depression. Then you can use particulate or respirator mask like for fitted N95, not required for measles or varicella if the patient has taken vaccination. Okay. Sorry, if the staff has taken vaccination. Okay. Client should always wear a surgical mask whenever the patient moves out of the room. So in which cases you have to use airborne precautions? In case of measles, that is also known as rubella, then chickenpox, that is varicella, and you have to add contact precautions as well in chickenpox. Then for TB, that is tuberculosis, then SARS and generalized herpes zoster, these require airborne and contact precautions. So these were the type of precautions that we can see. So we can again review. So first we did about the chain of infection, then we did about standard precaution, then contact precaution, droplet, and airborne. So standard precautions are the ones which are used for all the patients that you have to use. Contact for all contact diseases, like they mentioned over here. Then for droplet, Spider-Man, and for airborne, my chicken has TB and SARS. This you can remember. Okay. Then these are the questions. So we can see. So the nurse needs to assign a room to a 6-month-old child with bronchiolitis. Which room choice is the best? So you should first of all see, first is 6-month-old. So 6-month-old is what? Susceptible host. Second is bronchiolitis. Which room is the best? So first you can review over here that bronchiolitis is contact precautions. Okay. So we can see over here. So in case of contact precautions, so what you have to see, so private room with negative air pressure, double room with patient in droplet precautions, then private room further from the nurse station, or double room with a 4-month-old with RSV. Okay. So first, which room you can see, give to the patient. First is you can, they are saying bronchiolitis. Okay. Private room with negative air pressure, double room with a patient in droplet precaution, private room further from nurse's station, and double room for a 4-month-old child with RSV. So bronchiolitis and RSV have the same type of precaution. So the right answer will be the D1, that is double room with a 4-month-old with the RSV. Okay. Okay. Then you have nurses changing a surgical dressing. After the old dressing is removed, the nurse needs additional light. Which principle is violated if the nurse touches the light switch while wearing the gloves used until now? So surgical asepsis, infection control, standard precautions, or contact precautions. So which principles we are violating? Infection control principles. Okay. Okay. Then we have PPE, that is personal protective equipment. So we have two things. One is donning, another one is doffing. So donning is how you will wear the PPE, and doffing is how you will remove. So for PPE, first you will always wash your hands. Then for donning, first you will wear the gown. Then you will wear the mask or respirator, then goggle or shield, then gloves. And for doffing, first you will remove the gloves, then the goggle or shield, then gown. At the end, you will remove the mask or respirator. And the end, you will do hand washing. Okay? So everything is removed before leaving the room except the N95 mask. Okay. So in detail, we can study that how which part you have to touch, which part you don't have to touch. That in detail we can do in the upcoming classes. Okay. Then after that, first you have donning gloves. Okay. So how you will put the gloves? So donning means putting on, and doffing means putting off. Okay. So first is you have to take off all the jewelry, then avoid wearing artificial or long nails, then fold your sleeves up, or wear a short sleeved shirt. Okay, then wash your hands thoroughly. If there is a wound, then you can cover it. Then step 2 is choose the correct size of the sterile glove packages. You have to see the correct size of the sterile glove packages. Then don't touch the inside of the sterile package. Pull the edges on the outside open. So you don't have to have, so you can see first you have to remove everything, do the hand washing. Then you don't have to touch the inside. You have to you don't have to touch the inside of the packet. Okay. Then after that, the manufacturer always fold the cuffs to reveal the inside so that you don't have to touch. Okay. Then of the sterile glove. So with your non-dominant hand, pick up the other glove and slide your dominant hand. So first you will put in the dominant hand, then the non-dominant hand. Okay. So you can see in the picture, and I can give you a demonstration on this also. Okay. In the next class, we will see the demonstration of this, how you can wear the donning of this. Okay, then removing. So with your dominant hand, see in the first picture, you can see grab the outside of the other glove and slowly pull it off. So with the dominant hand, first you will remove the glove, then allow it to fold inside so that your hand does not touch the outside. So you have to keep this very important in mind, that in case of donning gloves, what is the sterile part? The outside is the sterile part, and the inside is the unsterile part. Okay. And in case of doffing gloves or removing gloves, the outside is the infectious part, and the inside is the sterile part. Okay. Then after that, we have two types of sepsis. One is medical asepsis, one is surgical asepsis. So what do you mean by asepsis? Asepsis, sepsis infection. Asepsis is in absence of infection. Okay. So first is medical asepsis. So in medical asepsis is used for all those which are not invasive procedure. Okay. So in this you need clean environment, no sterile environment, hand washing, then clean gloves, PPE and disinfectant you have to use. Hand are rinsed with fingers pointing down. Then like oral medication, vital signs, procedures in nose, mouth, vagina, rectum, all these you can use medical asepsis. Whereas surgical asepsis, you want the field should be sterile, that is no microorganism. First, you have to scrub the hands. Hands are rinsed with fingers pointing upward above the elbows, like in urinary tract, trachea, body cavities, IV therapy, TPN. Then you have to open the sterile kit. First, you have to check the kit if the kit is torn or expired. Then first, you have to open the first fold away from your side, okay? Because we are infectious and that is sterile. So you have to keep the first, you have to open the fold away from your side, okay? Then you have to keep the sterile wheel always in vision, okay? It should never be low from your waistline. Then 1 inch 2.5 centimeter margin around the edge are not considered as sterile. Wet surfaces can contaminate, so anything wet can if there is wetness or any water is there or splashes of water are there, so you have to consider that as unsterile, okay? Only sterile objects can touch the sterile field. Down is sterile from waist to shoulders. Date sterile saline bottles. When you have to open, you have to dated bottles. Then place the cap upside down on the clean surface, not in the sterile field. So these things you have to keep in mind, okay? So these are the points or the topics that we have to cover if we talk about safe infection control. Okay, so that is chain of infection. Then you have transmission based precautions. So first is standard precaution, then contact precaution, then you have droplet precaution, airborne precautions, and PPE and donning gloves, removing gloves, ape sepsis. So for donning, doffing, and for PPE, I will be giving you a demonstration on that. Okay, like we used to have procedures in our nursing colleges and that, so I'll be doing like that so that it is very clear for you that how you have to keep a sterile field, how you have to remove the gloves, how you have to wear the gloves, how you have to wear the PPE, how you have to remove the PPE. Okay, so because these are certain important things that you need to know, these are basics. So if your basics are clear, then only we can, the concept is clear. The main thing for NCLEX is clearing your concepts, because concept clearance is the main thing in that. Okay, and questions, then the upcoming class we will do the procedure as well as the question which are related to this. Okay, so I hope the today's lectures were effective for you, and you've understood that. In case you have any doubts, then you can ask me any time of the day. You can just text me or you can give me a message or anything, or in the next class we can take the topics for you. Okay, and if my speed was fast, slow, then also you can tell me. And if my mode of communication was like, if you want any other mode of communication, like if you want me to use Blackboard or you want me to use any other things, then I can use that also. So I hope my topic was clear for you. And so this is, I think, the main thing for NCLEX is theory as well as more and more questions that we practice. So first, you need to clear your concept, then you have to practice more and more questions, because there is, if you, even if you practice 10,000 questions, you will not get the same question in the exam. But with that 10,000 practice questions, what will happen? Firstly, your fear will go away. Second, what will happen? That the questions that you practice, the technique, it will help you in your exams. Okay. So this was from my side. So this is Gurleen signing off. Thank you so much. Thank you.